Hi guys, it's Little Mama Liv. Welcome to my channel. Today I'm going to be talking to you about my 28-week appointment and my anti-D injections, which I had all in one appointment. I'm 30 weeks today. Woo, it feels like a big milestone. And I actually had my 28-week appointment in my 29th week, but that was just because I think that was all they could book in for me, which is fine. It doesn't have to be bang on 28 weeks, I don't think. So they did a little checkup on me and the baby, and also I had anti-D injections. Now, I'm going to try and explain a little bit about anti-D injections and what they're for. They're not the most common thing in the world, but there were quite a lot of women on the same day getting them as me. So yeah, but it's more likely that you're not going to need anti-D injections. The reason I need them is because I have a negative blood type, which means that I am rhesus negative. And the problem with that is that it's a little bit rarer, and if the baby is positive, if the baby has a positive blood type, there can be some complications with that. There's a thing called rhesus disease, which can make, I can't remember if it's me or the baby, or possibly it could be both, quite unwell. But essentially, if the positive blood mixes with the negative blood, antibodies can be produced to kind of attack the other blood. I'm explaining this really badly. I am definitely not a doctor. That's how I understand it, is that we've got like clashing blood types. We don't actually know if my baby does have a negative blood type or a positive. If they have a negative blood type and I have a negative blood type, then that's absolutely fine, no problems to look out for. But obviously, if she is positive and she will be tested when she's born, then I will need more injections. So the injections just help to, I think it's to like mop up those antibodies that could possibly cause that conflict when the two blood cells meet. So it just means there's less of a risk of any problems. So it is optional, but of course I wanted the best for me and my baby, so I went for it. I made the mistake of looking up what it's like, and somebody on Facebook had put, oh my god, I'd forgotten how bad anti-D injections are, and all the comments were like, oh, it hurts so much, doesn't it? It's horrible. Oh, I hate it, I hate it, I hate it. And I was like, oh god, I wasn't scared. I wasn't that scared. I'm not great with needles, but nobody is. And yeah, so I was like, oh god, so I was dreading this appointment. And when it came to it, I was actually really, really nervous. I remember sitting in the waiting room being really, really nervous. So I'll start from the start. Obviously, this is going to involve talk about needles, so if that's not your thing, this maybe isn't the best video for you. But yeah, so I turned up at my hospital. I've spoke about it before in my 20-week scan video, that they have a coronavirus policy at my hospital where you literally can't get through the main doors without being checked for your temperature, and you have to fill in a questionnaire that asks if you've had any symptoms or anything like that, and they literally don't let you move past that point until you've filled that all in and they've guaranteed that you are absolutely fine, which is great. It's actually really reassuring. I know that might make people feel a bit intimidated, but it is really reassuring that they literally will not let people in if they've had any symptoms or if they've got any raised temperature at all. So then they usher you in, and I sat in the waiting room. The waiting room chairs were spaced 2 meters apart, which was actually a bit tricky because it was quite busy. The last time I went, my appointment was at like 8:30, which was, I think, pretty much when the hospital opened, and there was nobody in there. There was like me, and then I got joined by 2 other people. But this time it was 2 o'clock, I think, so it was pretty busy. It was a bit difficult finding a chair. I did think I was going to have to like stand and hover for a bit, but I did manage to find one. And then yeah, I went and waited for my appointment. It was quite a long wait. I was, I think, about half an hour to 40 minutes late for my appointment, but they did say they were having problems with their system at the moment, and obviously they are so swamped at the moment, so is understandable. The only complaint I have is that they were like, they had the TV on. They always have the TV on in the waiting room. And I don't know what program it is. It was like a soap. I don't know if it was Holby City because it was like kind of a doctor's soap. But they'd done it like it was social distancing, not social distancing. They were on Zoom calls. So all of the cast were on Zoom calls to each other, which was quite a clever way of doing it, I guess. But not only was it like really cheesy and awful, and like you couldn't get away with it because the TV was right in front of you and the volume was quite loud, but one of the main plot lines was that one of the main characters was dying from coronavirus, and it was just, oh, it was not like, read the room, you know? Like, we were all in a hospital, all of us sitting there, like, probably quite nervous. I was in my mask and everything, and it was just like, oh, I had to just like kind of look away and try not to listen. But it's not at all the hospital's fault. I'm not trying to say it's the hospital's fault, because they just had like BBC on or whatever it was. And that just happened to be what it was. But oh, it felt funny, this whole programme. And obviously because I was there for quite a while, I watched the entire programme. And you could kind of just see, read the faces of the other mums that were like, this is not what we want to be watching right now. Like, it was a bit creepy. But yeah, so then I went in for my appointment, and I thought the first thing they were going to do was my anti-D injections, but it wasn't. They did a full checkup of me, and they weighed me, which was interesting because I actually haven't been weighed since my first midwife appointment, so I had no idea how much it weighed, but my BMI is fine, so that's nothing to worry about. Checked my blood pressure as well, and they also got me to lie on the bed, and she had a good feel of my tummy. She told me where she's actually sitting at the moment, so her bum is right up here and her head is down at the bottom. She's kind of diagonal at the moment, so she's not exactly where she's meant to be, but she's got some time to get there. I think that's fine. They didn't seem worried. She's at least head down, but yeah, she just needs she needs to turn a little bit to get into the ideal position. But yeah, I at 29 weeks, and that was fine. They said there was nothing to worry about. And she also measured my bump, and she's in the 50th percentile, which is bang on perfect, I think. I mean, obviously the perfect isn't the right word there, but yeah, she's average. She's growing as she should be, not too big, not too small, nothing to be concerned about, so I was so happy about that. And they also used what's called a Doppler on my tummy, which I've never had used before. I've heard a lot of people talk about them, and I think some midwives use them early on, but I haven't had it at all. This is the first experience of hearing my baby's heartbeat. So essentially what it does is, it's the same gel they put on for the ultrasound, but then they rub this little device, this little like electronic device, and you can hear the baby's heartbeat, and again, strong heartbeat, everything fine. So they were really happy. They were saying that, yeah, everything seems like it's going really well. They also took a urine sample, and they took a blood sample as well, which I ended up, if you're squeamish, skip past a few seconds. Yeah, okay, just giving you a chance to skip this bit if you are a bit blood squeamish. I squirted blood everywhere. It was a bit embarrassing. She was like, whoa, okay. Yeah, she gave me my blood test, and there was blood all over the floor, and she was like, oh, it's like, I can't remember what she said. She said a horror film. I can't remember which horror film she said, but yeah, she was like, oh god. Oh, I think she said Patrick Bateman, actually. But yeah, I was like, oops, sorry. That was a bit funny, but a bit embarrassing, because she said it was this close to squirting her in the face with blood, which would have been not very nice. Anyway, enough about blood. Then she took my anti-D. She gave me my anti-D injection, and I was so nervous about it. So I was just trying to chill out. She was obviously trying to relax me as well, which was really nice. She was asking me what name we were going to go with, and I told her, even though I was a little bit worried because I'm not really telling many people. But yeah, she really liked the name as well. I mean, they have to say that, but I think she did genuinely really like the name. And the injection wasn't that bad at all. It was it was, I'm not going to say it's not painful, because it was. And it was, for me, it was like, it was a little bit like, it was ow, and then ow, and then it was out. So rather than it just being quite quick, it did feel like it was a bit of a ow kind of thing. She said that because it's penetrating to the muscular level, so it's a bit of a longer needle, I think. But it wasn't bad. I actually find the blood test worse, so if you're trying to gauge what it's like, I'd say the blood test is worse. And it wasn't really that much different in terms of pain to my whooping cough vaccine. So if you've already done the whooping cough vaccine, you can do your anti-D injections. It should be fine. I mean, everyone's different. Everyone's pain tolerance is different. Everyone will be feeling different as well. Obviously, if you're particularly tensed up and nervous, it will hurt more. But I really tried to practice my breathing and everything, and just get it over with. Just remember it's quite quick, and it's good for you, good for the baby. So why not get it done? Yeah, so that's all fine, and yeah, it was actually a really lovely experience. It was really nice just talking to somebody about the baby, because I haven't had an actual face-to-face midwife appointment since my first one, which is really strange. She wasn't actually my midwife that I usually have. I say usually have, I've only seen her once, but you're meant to have the same midwife throughout your pregnancy usually. And I've had telephone appointments with my original one, but I haven't seen her face to face since before lockdown. So this was just one of the hospital midwives, but she was lovely and it was really nice. And I think I am going to have a face to face appointment with my original midwife soon. So yeah, that's nice. That's just one of those things that's been a bit difficult through lockdown, because I always envisioned having quite a close relationship with my midwife, but it's been so difficult because all we can really do is text and phone each other, and it's harder to ask questions and things because I don't want to text her to bother her. Sometimes it takes her a long time to get back to me and things like that, and I feel like if I just had a regular appointment with her, it would be easier to ask little questions and stuff, things that aren't necessarily not emergencies, but you know what I mean, like big concerns, just little things. I don't want to bother her with a text, but if we were having regular appointments, then I could ask her things. And that would be fine, because it's an allotted time that I'm allowed to take up her time. But yeah, that's a little bit of a shame. But as I said, this midwife was so lovely, so kind. And yeah, essentially that was it. And at the end, she said, just sit down, wait 10 minutes. They usually do this with your flu jab as well, if you've had a flu jab. They say sit down, wait 10 minutes, see if you're okay, and if you're feeling okay, then you can go home. And I felt fine. I didn't even have any aching or bruising in my arm, which I did with the whooping cough vaccine. No bruising or anything, just a tiny little red dot on my arm that healed up absolutely fine. My blood test results are back as well, and I need iron tablets. I'm not iron deficient, but she said I'm towards the lower end of the scale of okay. So I should rather just make sure that I'm right there in the healthy centre, which is fine. I've been taking 2 of those a day. So yeah, hopefully everything's going great at the moment. Let's hope it carries on. So that's what to expect from your 28-week appointment, and your anti-D injections. You might have them done separately. I had them done together, which was convenient and nice. Yeah, and essentially, don't be scared. Enjoy your time listening to your baby's heartbeat and understanding more about how your baby's growing and developing. Yeah, so thanks for listening, guys. As always, subscribe down below if you want to see more from me, and also give it a like if you like this video, obviously. And I'll see you in the next video. Bye!